Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1. Questions 1 to 12.
You hear a GP talking to a woman called Sarah Robertson. For questions 13 to 24, complete the notes with a word or short phrase.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, what's troubling you today, John?
I have this really weird-looking rash thing on my chest. It's kind of below my collarbone, and it's become really itchy over the last day. It's really bad at the moment, actually, and I can't stop scratching it. I'm trying, but it's too hard, and it looks all kind of scaly and pink. It's pretty weird. And then yesterday morning, after my shower, I noticed there's a lot more of these little spots coming up around it. There'd only been a few up until then. It's definitely getting worse, look.
Okay. Well, that looks like what we call pityriasis rosea. A fancy name for a rash, really. It's common for your age group. Have you been ill at all recently?
I had a bit of a cold for a few days last week. Just a runny nose, sneezing, that kind of thing. I'm fine now, though. About 3 weeks back, I had a really bad nosebleed, and my mum took me to emergency, and it ended up being nothing.
Having a cold right prior to an outbreak is quite common too. The rash usually clears up by itself after a couple of months and rarely reappears, but you'll need to avoid excessive sun and regularly apply generous amounts of moisturiser.
But I have a beach party this weekend at my mate's holiday house. If I can't be out in the sun, then there's no point going. It's actually his 18th, and he's my best mate. Also, this looks pretty disgusting, and there'll be lots of people there. Isn't there something I can take to help clear it up, or at least stop it from spreading more? Because if that happens, by the weekend it could cover my whole body.
Oh, that won't happen, I can assure you. But you will have to keep your shirt on for the hottest part of the day. Do you have any allergies, John?
Yeah, I've been allergic to dust mites since I was about 13, I think, so my mum's always cleaning. My skin usually just gets really itchy, and I sneeze like mad. When I was really young, I was allergic to milk, but I'm over that now. The only other thing I have to keep away from is that stuff they put in cheap takeaway food to make it taste nicer. Oh, what's it called? MSG, that's it. That stuff gives me shocking headaches, makes me so tired that I can't do anything for about a day.
How about medical history? Have you ever had any major illnesses or operations?
I had chickenpox when I was a toddler, but I've also had to go to hospital 4 times for things. I've been a skateboarder since I was 6, so I've had a few spills. I broke my left wrist when I was about 8 years old, skating off a quarter pipe. That was a pretty bad one, but I made it over 5 of my friends who were all lined up on the ground. Then later, I'm not sure how old I was, maybe 11, I had one of those really small breaks, like a hairline fracture in my elbow. I also broke 2 of my fingers on my right hand. I had to have them strapped up. That was a pain. And then my last one was last year, and was probably the worst because it was so painful. It made the other ones seem like a joke. I had to go into emergency because of some pretty serious grazing along my leg. I came off my board going down a hill on the side of this really rough road. It had dirt all in the wound.
Ooh.
They just washed it out and put bandages all up my leg, but I was in agony.
Well, hopefully that'll be the last of your injuries, so...
Extract 2. Questions 13 to 24.
In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting.
You now have 30 seconds to look at the notes.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
OK. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old, and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hands into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there. My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, the tears are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them. But maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
OK. Well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Not at the moment. I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least. Now, before I give you any other...
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a ward manager talking to a nurse about a patient complaint.
John, there was a written complaint filed from Mr. Boeing in room 6. He says that he requested a private room last night, which you promised he would get. Then you ignored his attempts to speak with you, even when he was in considerable pain. What happened?
He asked to be moved because he was uncomfortable and in a lot of pain. Unfortunately, Mrs. Stewart took a turn for the worse and needed closer monitoring. I needed to prioritise the ward accordingly. He received all pain medication at the correct time.
I see.
Normally, I'd have discussed it with him, but time just didn't allow for it. I had to be where I was needed most, and that was taking care of Mrs. Stewart.
Your job is to prioritise, and you did just that. I'll go in and talk to him and see if he still wants to pursue it, because it's quite a serious allegation.
Okay.
Question 26. You hear 2 nurses discussing a recent change in hospital policy.
Did you read the notice that patients who are HIV positive no longer have to declare it? That means we'll have no idea of their status.
Yeah, I just finished reading it.
What does that mean for us? It's in our best interest to know. We need to take extra precautions.
Actually, we shouldn't have to do anything differently. That's the point of universal precautions.
So, are you comfortable taking on patients when you don't know whether they have HIV? We have a right to know.
If I'm working the way I should be and using all the protection equipment I'm meant to be using, then I don't have any need to know. That's why there was such a strong push in the profession to make universal precautions standard practice. If you're following the guidelines, then you're not impacted.
Question 27. You hear a hospital physiotherapist talking to a trainee about the cardiac rehabilitation program.
After cardiac surgery, it's important that we get the patient moving. They don't always want to, usually because of fear. They've just had a sternotomy, so they're frightened it might burst open.
I would be too.
We have to encourage deep breathing from the outset. For this, we use an incentive spirometer, a very important apparatus to help prevent pneumonia, amongst other things. The next step is to start ankle pumps and circles to help prevent the pooling of blood in the lower extremities.
Okay, they sound simple enough.
Not so simple for them. So it's important you explain why they're doing the exercises. The next step is standing and sitting. They'll clutch their chest with a pillow to stop from using their arms. It's vital for flexibility and muscle tone. Finally, we get them ambulating. How far they walk determines when they can go home. That's always a good incentive.
Question 28. You hear a radiographer talking to a patient about her X-ray procedure.
Now, Mrs. Daniels, I'll need you to keep your arm as still as possible for me. I know you're in quite a bit of pain, so I'll try to be as quick as possible.
I'm sorry, I can't keep it still because I'm shaking. I'm nervous. I may have broken an arm. I've never broken anything before, never had surgery, and the thought of lying on an operating table just frightens the life out of me.
I understand you're nervous, Mrs. Daniels. It's perfectly normal. Just try to take some nice deep breaths, and then when you feel you're ready, we'll start.
But it's hurting me. I had no idea X-rays hurt.
No, it's not the X-ray itself. It's the positioning of your arm. I'm sorry, but it's necessary to take them at various angles so the doctors can see even the smallest of hairline fractures.
Okay, I'll try.
Well, you've got what's known as a bunion.
Question 29. You hear a podiatrist talking to a patient with a bunion.
It's just so ugly. I've even stopped wearing open-toed shoes. How did this happen? I mean, I'm far too young to have this.
That's actually a common misconception. The condition can be inherited or even associated with diseases of the joints like osteoarthritis. But the most common cause is poorly fitting footwear, particularly shoes with narrow toe boxes.
Most of mine do have rather narrow ends, but surely that can't change the shape of your foot. I mean, my big toe's pointing in the wrong direction.
What actually happens is the metatarsal, which is the long bone in the middle of your foot, deviates towards the other foot, while the hallux, otherwise known as the big toe, pushes towards the other toes, so we get a very prominent joint protruding outwards, such as you have here.
I see.
Question 30. You hear a surgeon giving details of surgical complications to a patient.
As with any surgical procedure, there are possible complications which you need to consider.
I see.
Tonsillectomy is common, but can pose considerable risks, especially in adults such as yourself. So, monitoring for and reporting any signs, especially in the first few hours, is crucial. You'll be having a general anesthetic, and although reactions are quite rare, it does have potential dangers. During the operation, there's the chance of excessive bleeding requiring further treatment or intervention. After the operation, swelling of the tongue and soft palate can occur, leading to difficulty in breathing, and, of course, bleeding may occur during this time also. This is also when infections can occur. Now, I must stress again that although such complications are rare, if you do experience any discomfort or if anything's worrying you, you must contact me immediately.
Okay.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
You hear a presentation on treating scoliosis by a physiotherapist called John Booker.
You now have 90 seconds to read questions 31 to 36.
As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief. Although not all scoliosis sufferers will experience pain or even discomfort, many do, and for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of tight muscles through gentle massage, acupuncture, the use of supportive postural taping, and various electrotherapy modalities such as ultrasound. Phase 2 is a particularly important step for several reasons. It's for rectifying any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility have increased. Physiotherapy here focuses on both sides of the spine as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, muscle length and strength, as well as endurance and core stability. This stage is paramount for allowing ongoing treatment in phase 3 to occur. This is because it's there that the patient requires the strength and flexibility gained in phase 2 in order to resume normal activities. These include sport and recreation, which is the objective most patients have in mind during the treatment process. It's where we aim to restore full function. This is where we as physiotherapists need to tailor rehabilitation to the specific patient so they can safely achieve their functional goals. This of course includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilised. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies greatly. However, those with mild to moderate scoliosis who have a commitment to maintaining their newfound strength and flexibility can expect a full recovery, especially if diagnosed and treated early. Physiotherapy is a vital part of this recovery and prevention and should never be underestimated. So, the next time you're asked, can physiotherapy help my condition, I'd be inclined to give a firm nod and respond by saying, with your commitment, physiotherapy is invaluable.
Now look at Extract 2. Extract 2, questions 37 to 42.
You hear an interview with Dr. Christian Thomas, who is talking about the diagnosis of cancer and a new tool called CancerSeek.
You now have 90 seconds to read questions 37 to 42.
My guest today is Dr. Christian Thomas, co-author of a study into a new blood test known as CancerSeek. Dr. Thomas, can you tell us what led to the study?
Diagnosis for many cancers is a long and challenging process. Cancer remains one of the leading causes of death all around the world, and it's estimated that by 2030 the number of cancer deaths will almost double. So early diagnosis is crucial to reducing cancer-related deaths. That is, the earlier the disease is diagnosed, the higher the chances of treatment success. But sadly, many aren't caught until the later stages, and this is largely due to a lack of fast and effective diagnostic tools, and that's where research is vital. So that prompted our team to test the latest research on a relatively small group of people, and the findings have been quite encouraging. It could potentially bring us closer to a quick, simple way to detect cancer in its early stages.
Can you give us more details and perhaps explain the importance of the test?
Sure. The test is called CancerSeek, and it's a unique, non-invasive test that simultaneously evaluates levels of 8 cancer proteins and the presence of cancer gene mutations from circulating DNA in the blood. It's aimed at screening for 8 common cancer types that account for more than 60% of cancer deaths. In fact, 5 of the cancers covered by the test currently have no screening test at all, so that alone gives an indication of its significance to the medical world. The use of a combination of selected biomarkers for early detection also has the potential to change the way we screen for cancer, and it's based on the same rationale for using combinations of drugs to treat cancers. Circulating tumour DNA mutations can be highly specific markers for cancer. So, to capitalise on this, we sought to develop a small yet robust panel that could detect at least one mutation in the vast majority of cancers.
What kind of success rates has it shown in detecting cancer?
It's been a very positive study. From 812 healthy controls, it produced only 7 false positive results, so that was very encouraging. The test itself was evaluated on 1,005 patients with non-metastatic stages 1 to 3 cancers of the ovary, liver, stomach, pancreas, esophagus, colorectum, lung and breast. The median overall sensitivity, or the ability to find cancer, was 70% and ranged from a high of 98% for ovarian cancer to a low of 33% for breast cancer. Still a reasonable result and above what we anticipated. For the 5 cancers that have no screening tests at present, which are ovarian, liver, stomach, pancreatic and esophageal cancers, sensitivity ranged from 69% to 98%.
That's very impressive. Your team must be very pleased. Is there any downside to the test?
Many of the most promising cancer treatments we have today only benefit a small minority of cancer patients, and we consider them major breakthroughs. If we are going to make progress in early cancer detection, we have to begin looking at it in a more realistic way, recognising that no test will detect all cancers. We may only be in the beginning stages, and although CancerSeek doesn't pick up every cancer, it identifies many more that would likely otherwise go undetected.
What impact are you expecting this to make right away on the general public?
This test represents the next step in changing the focus of cancer research from late-stage disease to early disease, which I believe will be critical to reducing cancer deaths in the long term. As I mentioned, CancerSeek is non-invasive, so can, in principle, be administered by primary care providers at the time of other routine blood work. This has the potential to substantially impact patients' current levels of access. Earlier detection provides many ways to improve outcomes for patients. Down the road, optimally, cancers would be detected early enough that they could be cured by surgery alone. But even cancers that are not curable by surgery alone will respond better to systemic therapies when there is less advanced disease.
And what about affordability for those undertaking the test?
We feel that a test that will be used routinely for cancer screening must have a cost in line with or less than other currently available screening tests for single cancers, such as a colonoscopy. For example, the average out-of-pocket expense for that procedure is anywhere between $1,000 and $3,000. We envision that the CancerSeek test will eventually cost less than $500. Of course, much larger studies of the test are currently underway and cost can't be a determining factor over quality, but I'm very confident that we will be able to keep it at the estimated level.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.